Good afternoon. I'm John White, and this is my final project for BA 513 at Western Kentucky University. I chose to focus on those most vulnerable at catching COVID-19 and what the data tells us. The media has been saying conflicting things, primarily that the elderly are most susceptible to catching the illness. However, now data suggests that the elderly are not the most susceptible to catching it, but the most susceptible at developing severe complications as a result. And we'll just have to take a look at the data and see what age group is maybe most susceptible to catching it. You can see here I just pulled a picture of where it took place. The COVID-19 is believed to have first appeared in Wuhan, China. The red shaded area is Wuhan, and experts believe that it started in a fish market. I've heard conflicting things about that too. I think time will tell where exactly it started, but as of now, experts believe it started in a fish market in Wuhan, China. Symptoms, they can take up to 14 days to present themselves. That combined with the fact that the virus is highly contagious. An individual could have the virus and not know it until they present symptoms, which could be a while. That means that they will continue on with social interaction. Although ill-advised, there's limited social interaction that's still taking place despite government steps and interventions to prevent social interaction and to slow the spread. When symptoms do present themselves, they are cough, fever, shortness of breath, muscle aches, a sore throat, diarrhea, and headache. And what makes coronavirus so concerning is that it can lead to severe respiratory problems, kidney failure, and even death. So it's very important that we slow the spread, and as it's been talked about in the media, in an attempt to not overwhelm the healthcare system. This further is supporting the fact that it's really important to identify those age groups that are most likely to catch it and spread it to others, so we can slow the spread of this illness itself. If the spread of the illness is slowed, it's likely that there won't be such a strain on the healthcare systems, and if somebody does contract it, that they're able to get the help they need at a local hospital, and the hospital will be equipped to actually treat an adequate number of patients and have the supplies needed on hand to treat the people who catch it. This is a simple map showing some of the areas that are most impacted. You can see as of March 16th, the CDC reported that 508 people were hospitalized because of the virus. Of those, 38% were between 20 and 54 years old. That's quite a lot. Half of those ended up in intensive care were younger than 65. So now we have preliminary data showing us that nearly 40% of the cases in the United States are between the ages of 20 to 54. And half of those requiring intensive care were younger than 65. The misconception is it's likely that only the elderly population will require hospitalization. Early research, early data is showing us the opposite, and that not only are a large portion of middle-aged citizens catching this illness, this virus, but also requiring intensive care and putting an excessive strain on the healthcare system. So, using some of the data available, I was able to put together some graphs that'll help us articulate what age groups are most susceptible at catching this illness. I chose to focus on the most populated states on the East Coast and use that data to help focus in on those age groups most susceptible. It's clear that New York, as we most know, is at the forefront of this pandemic and has the most cases. It's likely a result of increased contact between the citizens, increased use of public transportation, and the following states don't have as much contact with each other, which makes sense considering how the virus is transmitted. This further shows the amount of cases in New York compared to the other states. Florida, with the second highest number of cases, followed by Pennsylvania. These are the states here that we'll choose to focus in on shortly to kind of grasp and understand those age groups most susceptible to catching coronavirus. This pie chart just further outlines how many people in New York have caught the virus compared to the other states. Quite alarming when you see this picture, and it can't help but outline how contagious this virus actually is, how it's transmitting from person to person, how easily this virus can live on surfaces that we touch daily, how easily it can be transmitted through droplets in the air or talking with people, which has further caused increased government intervention. Some states, I believe, are requiring masks to be worn. The state I currently live in does not require masks to be worn, but as we understand this virus more and more steps are being taken to help slow the transmission of the virus itself. This is a graph where the preliminary data suggests that between the states listed here, this is the height of each age group. New York's average age, or the highest infected age, is 41. The highest infected age, or the largest number of infected persons in New Jersey, is 36, which is quite low. Pennsylvania being 46 and Florida being 48. This data suggests that these age groups are most likely to catch and transmit the virus around these age groups. And it's not the elderly populations as previously focused on in the media itself. Another topic of discussion regarding the transmission of the virus is the gender of the populations catching it and age groups catching it. Early research suggests that the majority, or not the majority, but a large portion of those most susceptible to catching it and transmitting are males. According to this data, the difference is negligible, although males appear to slightly be more likely to catch and thus transmit the virus to other people. This shows medical conditions, which is really important. It's important for determining the ages affected, but it's also important because it helps us understand those members who catch the virus and possibly recording the number of cases. It's, in my opinion, unlikely that somebody who catches the virus yet does not have a lot of bad symptoms or is not in a severe situation likely won't reach out for medical care. Maybe their case goes undocumented. So considering the pre-existing conditions here, it will likely determine the percentage of the population who will reach out for assistance, which will result in a documented case of the coronavirus. Florida being the highest, with the most cases or with the most members having a pre-existing medical condition, followed by New York and Georgia. This number likely suggests an increase in ensuring that those in New York and Florida and even Georgia get their case documented. It's likely, considering the pre-existing health conditions throughout those states, that they'll reach out for help, which will result in care for the member, but also ensuring that case is documented. This shows, utilizing the previous data, the states that are most at risk. Maryland is the highest at risk for citizens for catching the coronavirus. And because of that, we'll use Maryland as a focus group in the next data set, but it can show you by using that data which states are most at risk for their population contracting the virus. And that's not just population size. It takes into consideration pre-existing health conditions, number of people in the population, number of people who have caught the population, the age of the population, and numerous factors that go into determining who's most at risk. This slide is key to identifying those ages in Maryland that are catching the virus, considering Maryland was most susceptible. The citizens of Maryland were most susceptible to catching the virus. will further focus on the age groups that have been catching it. This chart does not continue past 60 because it stays the highest. This chart does not continue below 22 because it also stays relatively low. So in an attempt to focus on these age groups, it's clear that between the ages of between late 20s to early 50s are the most susceptible at catching this virus. This is also on an account that these cases are documented. Those younger than 22 years old maybe their case may not be documented as often. However, there's numerous reasons that could cause increased spikes in this age group. What's likely is the continued person-to-person transmission, availability between that age group, continuing increased social contact relative to the other age groups being one of the main concerns. This is the workforce, a very workforce dominated age group. So maybe they're continuing with work, causing more person-to-person transmission and therefore catching the virus. The age groups here likely having their cases documented more often as a result of health complications. So by determining the previous data that we've looked at in conjunction with the hardest hit areas in the country, and then further focusing on Maryland, it appears that late 20s to late 40s are the largest age group susceptible of contracting coronavirus. As a result, most likely the age group that is going to pass it on to other members of the population. And it requires increased awareness of the fact that those age groups are likely contributing to the continued spread of the virus. And not only are they likely continuing to spread this virus, but it's also the age group that's still very much at risk for developing severe complications themselves. So that's the data shows. It is that age group between late 20s to early 50s. Not only are they passing it to other people, but also are at severe risk themselves. I believe that more data should be used to display this information, and the media should make that more available to the public and increase the awareness of the population of the United States to help decrease the spread of the virus, flatten the curve to ensure that medical has the tools and capacity necessary to treat those severe cases and help slow the spread. This concludes my presentation. Thank you for taking the time to watch it. Have a great day.